Hundreds of thousands of Ontarians have gotten used to not going to the actual doctor's office and instead having a virtual visit during the pandemic. While medical professionals say virtual care helps patients access health care, they are concerned that not everyone is benefiting equitably.
When you think about convenience and ease of being able to connect with a provider and a doctor, that's helpful. It eliminates the need, for example, potentially for travel to and from a doctor's office.
A study by the Canadian Medical Association found almost all Canadian physicians plan on using virtual care after the pandemic. 2,000 physicians took part. 94% said they currently use virtual care. More than 70% believe virtual care improves patient access and quality care. While it's an option of convenience, there are some issues.
We have to remember that there are many people out there in our communities who do not have access to the kinds of technologies that allow them to participate in virtual care. Not everyone has a smartphone. Not everyone has high-speed Wi-Fi. There's also people in our communities who are dealing with mental health and mental illness. And sometimes people need extra supports to be able to get that kind of access.
Health equity lead at Kensington Health, Dr. Nahi Dasani, adds those experiencing poverty who don't have access to technology should be given smartphones and tablets.
There's often an assumption that people who live in poverty or people who lack access to technology don't want to use the technology. That might be true for some people, but we find that the vast majority of people are ready to participate, whether it's, virtual calls by voice or camera.
Prior to the pandemic, the proportion of virtual healthcare visits in Ontario was small but growing. In 2018-2019, the Ontario Telemedicine Network reported that more than 350,000 people had more than 1 million virtual visits, up more than a third from the year before. That number has likely climbed during the pandemic. The president of the Ontario Medical Association, Dr. Adam Kassem, says virtual care should and will continue to be an option, but not the only one.
We're trying to collectively determine the right dose of virtual care, just like a medication. A medication has an intensity, so how much of it. It has a frequency, so how often it's delivered. It has a duration, so for how long. And then ultimately you want to be selecting the right patient for that treatment. Virtual care is no different.
Dr. Kassam says Ontario doctors are currently using temporary OHIP virtual care billing codes that are set to expire this September. They are advocating to make these permanent. The OMA is also urging the government to partner with internet service providers to provide reduced service rates for those struggling to pay, which would help address accessibility issues. For City News, I'm Maleeha Sheikh.